Hi everyone and welcome back to What Does the Research Say? Today we will be looking at breast reconstruction surgery, specifically while outlining the main options, considerations to be taken in, and breaking down the comparisons for you. I'm so excited to have you back and let's get started. So let's begin with what breast reconstruction surgery is. So this surgery occurs after you've undergone a mastectomy and now have the option to have an operation to make your breast look and feel as natural as possible after a part or all of it has been removed. This surgery is completed by a plastic surgeon with special training and often involves more than one surgery, which can include the second breast even if it didn't have cancer, in order to make them as similar as possible. Remember that this decision is very personal and should not be rushed. You have a few options to take into consideration here. And the first one is there are different types of breast reconstruction surgery. There's also prosthetics, which are worn inside the bra to give and create a natural breast form. And you can also choose to stay flat, which many women have been choosing to do more recently. In particular, a study in 2014 found that 44% of women chose to stay flat after a mastectomy. There are many things to take into consideration when making your decision, such as your overall health and any health problems you may have, the health of the tissue where the reconstruction will be done, whether or not you have or will have radiation therapy to the breast area, how much tissue was removed during surgery to remove the cancer, the amount of muscle or fat available for reconstruction, the shape and size of your body, and the shape and size of the opposite or unaffected breast. These are all very personal to your situation, so make sure to speak with your oncologist and plastic surgeon to decide what is best for you. So there are two main types of breast reconstruction, known as an implant or flap reconstruction. These can be done in combination with each other, or you may choose one singular option. So let's start by looking at the implant option. This option requires less surgery because it only involves the chest area and not the donor site as well. This being said, it may still involve more than one procedure and will involve additional surgeries in the future, usually within 10 to 20 years, because implants wear out and can develop scar tissue. An implant tends to be a good option for women with smaller breasts because they tend not to have the extra tissue on their body to form a good breast shape, which is required for the flap reconstruction. Implants are also a good option if you want minimal incisions/scars on other parts of your body, and if you don't want to endure the lengthier flap reconstruction operation. Additionally, if you have no need for radiation therapy, then implants can be a good option for you. With radiation therapy, there is a high chance of developing problems in an implant reconstruction, so make sure to speak with your plastic surgeon and oncologist about this recommendation. Finally, if you are considering implants, you should also be aware and willing to surgically alter your healthy breast to achieve symmetry, as implants may not align perfectly with your natural breast size and shape. So there are two options for the implants, and these are either the saline or the silicone gel-filled implants. Here's a chart to explain the differences between the two. So what I've done here is I've put the characteristics in the one column, and then we'll look at the differences between the saline implant and then the silicone implant. Let's begin with the components, so the interior of the actual implant. For the saline one, you have a silicone shell, which is filled with salt water or saline, and then the silicone implant is a silicone shell, which is filled with a silicone gel interior. Next, let's look at texture. So for texture, the saline implant is not as soft as silicone, so it doesn't feel as much like a natural breast, but the silicone one is softer and does feel more like natural breast tissue. Okay, so next for the interior substance. For the saline implant, this will actually be filled by the surgeon during the operation, but for the silicone one, it's pre-filled by the manufacturer. After this, let's look at the incision required, so kind of the scars that will be left. The saline implant, the incision is much smaller because the implant is deflated when it's inserted and then filled up, but for the silicone one, it's a little bit longer because the implant is full when it's inserted. Next on, ruptures. So for example, if the implant does rupture, it's quite obvious with the saline one, but for the silicone implant, it can be a lot more difficult to detect if that is burst or not. And finally, for the follow-ups recommended by your doctor, the saline implant doesn't really require many follow-ups, especially if you don't feel anything rupturing, but for the silicone implant, they do recommend periodic MRI screening. Okay, so now we understand a little bit the differences between the implants, but what about the implant surgery timeline or the time frame for that? This can happen at any time, so it can happen at the time of the mastectomy, known as an immediate reconstruction. You can also have a staged procedure, known as a delayed immediate reconstruction, or you can have a completely different procedure, known as a delayed reconstruction. An immediate reconstruction can occur if there is enough tissue available to cover the implant. But if a large amount of skin is removed during the mastectomy, then the plastic surgeon may use a tissue expander between the skin and the pectoralis major muscle. The expander acts like a balloon, and every 2 to 6 months, the surgeon will add increasing amounts of saline solution to the pouch to allow time for the skin to stretch and accommodate the implant. A quick reminder that if you are planning on having radiation therapy, ask the plastic surgeon to use an expander with a plastic port, not a metal one, because the metal will interact with the radiation and produce excessive skin damage. Moving on, let's look at the second option for breast reconstruction, which is flap reconstruction. This process uses tissue such as skin, fat, and sometimes muscle from another part of the body to form a breast shape. There are two types, the free flap surgery and the pedicled flap surgery. A free flap is where the tissue is completely separated from its original blood vessel and picked up and moved to the chest, where it is reattached to the body with a new blood supply. A pedicle flap is where the tissue remains attached to the original blood vessels and moved under the skin to the chest. This operation has been around for longer, so it is sometimes easier to find a plastic surgeon who does a pedicle flap surgery compared to free flaps. So here I will give you a list of the major options for flaps. They're mostly named off of the body part or major blood vessels that they are attached to. You can see that sometimes they come from the abdomen tissue, other times the back tissue, other times the butt and the hips, and then you also have thighs at other times, and sometimes you even use a combination of different areas, especially if you can't find enough tissue in one area. So for ladies who don't have as much fat around the abdomen, they may take from multiple areas and layer them. So as you can see, there are many options, and links will be provided in the description below for you to get even more information. So a study done on patient satisfaction in post-mastectomy breast reconstruction found that women were most satisfied when they had the flap reconstruction, and it was mostly abdominal-based. So instead of the implants or from different areas of the body, it's almost like getting a tummy tuck at the same time as having the breast reconstruction. So now that we've outlined the two major types of breast reconstruction, let's compare the two. Here's a table, again, to help compare your options. We're going to look at implant and flap. So let's start off with the time frame. For your implant, it's shorter, a less complex surgery, but you may have more steps overall. With the flap one, depending on the type, you can get done at the time of the mastectomy, afterwards, or stage. So there are many options, but usually it does take a little bit longer. For the incisions, the implant uses incisions from the mastectomy, so there's no new scars, but for the flap, there are new scars from other areas in the body where you're taking the tissue. For finding surgeons, it's easier to find a qualified surgeon for an implant because, again, it's an easier surgery to do, but you need more of a specialized plastic surgeon with specific training for the flap. For the feeling of the actual breast, the implant feels less natural, and it looks and moves a little less like a natural breast. But for the flap, since the tissue is from the actual body, tissues from the belly, butt, and upper thighs are very similar to breast tissue, so they can feel more natural. Finally, looking at lifespan, with an implant, you do have the risk of future problems such as a rupture or deflation, and for the flap, it tends to last a lifetime. A study looking at flap failures and overall complications found that women who are obese experience higher failure rates with implant-based reconstruction, particularly immediate reconstruction. So free flap or delayed implant reconstructions may be more successful for this population. Okay, so we now have looked at the breast reconstruction options, but what happens now? You've decided on your choice, you've had your reconstruction surgery, and now what? So a qualitative study found that, no surprise here, but women cope better after breast reconstruction when their support needs are effectively addressed. The four most important support needs identified were access to information, help with daily tasks, emotional connection, and being understood. These interactions were shaped with healthcare professionals, family members, friends, and other women who'd experienced breast reconstructions. So don't be afraid to ask your oncologist questions when you don't understand, and talk to others to explain to them what you're going through. Also, if you know someone going through a breast reconstruction, remember to be there for them and also address these areas of support if you can. A note to all healthcare professionals, please remember that the decision to choose or decline breast reconstruction should be made by the patient after she's had the opportunity to learn, discuss, and consider all the possible options. So please don't rush them into making this decision, because studies have found that patients' satisfaction with the decision is highest when the patient has been adequately informed and when she is heavily involved in the decision-making process. Overall, I hope you learned something today, and I'd like to thank you so much for watching. Again, all the references will be linked in the description box below.